As the world eases lockdown restrictions while trying to reduce the infection rate of COVID-19, we have a public health physician, Dr. Blossom Madua-Fokwa, and she joins us via Skype from Victoria Island on the program. Thank you for joining us at this time. It's been weeks we spoke to you last. I'd like to begin by asking how you would rate our efforts at the response to COVID-19 in Nigeria.
Okay, so the last time we spoke, I believe it was at the beginning of easing of the lockdown, the first phase, and we can see that there's still a rise in the cases that we're seeing daily, and this is why we utilize platforms like yours to basically implore the public to please pay attention to the simple things. Keep your distance from other individuals. If you don't have to go out, please don't go out. And if you do have to go out, make sure you use a face covering, wash your hands regularly. So to answer your question, there's been a rise in the number of daily cases, but there's still a lot that we can do by actually imploring the public to maintain these personal hygiene practices that have been proven to stem the transmission of this disease.
So strict additional safety measures still being key, but then the NCDC DG today was saying that they're receiving testing with fake names and also fake addresses. Why would you think that, we're still seeing things like this?
Okay, so in every process, you're going to have inconsistencies. You're going to have people trying to game the system. So some of these things are to be expected, but it doesn't take away from the fact that there's a lot of progress that is being made in ensuring that the cases are kept as low as we possibly can keep them. So these things will definitely happen in any process that we embark on. But we have to just pay attention to the protocols that we've put in place to ensure that we're keeping to these protocols and that we're enforcing them as well.
How effective would the collection of plasma from those that have recovered from COVID-19 help in our studies and perhaps further treatment of patients with COVID-19?
Okay, so the idea behind collecting plasma from people that have recovered is basically to utilize the antibody. So what happens is when our bodies come in contact with pathogens like viruses, bacteria, our bodies mount an immune response in the form of antibodies. So the thinking is, if we can collect the antibodies that have been mounted against COVID-19 or the virus that causes COVID-19, we may actually be able to apply the use of these antibodies in the treatment of other individuals that have come in contact with the virus. And also in some of the vaccine trials that are going on, some of these antibodies are actually being used to study the immune response of some of the vaccines that are being administered.
All right, Dr. Blossom Madua-Fokwa, public health physician. Good to see you. Thank you for joining us on the program.
Thank you so much for having me. I appreciate it.